Welcome to Healthbeat, Bhekisisa's monthly television show. I'm Mia Malan. South Africa could be facing another life esidimeni crisis. Lives are on the line because the Gauteng Social Development Department appears to be politicking instead of regularly paying NGOs the money they depend on for survival. But letting down vulnerable children and adults because funds have dried up isn't an option for those who refuse to abandon the poorest of the poor. Our team went out to see how funding cuts are changing day-to-day life for people who depend on social welfare organizations.
The Freedom Recovery Centre is situated far from temptation at Holgatfontein, 8 kilometers from Nigel in eastern Gauteng. The Department of Social Development named the facility the best treatment centre in Gauteng in 2018. The state-funded centre offers treatment, counselling and skills development to recovering drug users.
Listen, this is a problem. So when going back home, what makes it difficult for you guys to stay strong?
It's the lack of education for the people in our lives, our families.
Yes.
Now, the 10-year-old facility faces closure because the Gauteng Department of Social Development hasn't paid them. Derek Matthews is the CEO and founder of the Freedom Recovery Centre. He's unsure why funding has been withdrawn, as they've always had a clean audit.
So for the 10 years that we have been funded by Department of Social Development, we literally never had serious problems regarding funding. There was always a thing of, the SLAs or the panel meetings in November, December, the previous year already. By February, March, you would have your service level agreement.
In May, the department said it had pulled funding due to a pending investigation.
At first, when I got the WhatsApp from DSD, then about 2 hours later I got the email, and the email just was a random letter to say we are under investigation and we are not funded.
Derek says they're in the dark about the allegations against them.
I kept on emailing DSD, and no one could even answer us what is the allegations. And it's almost 28 days later. We're still waiting for any kind of reply. No one has replied.
Mangoba Makasi is one of 5 full-time social workers currently working without pay.
Actually, hearing that we didn't get any funding as Freedom Recovery Centre on the 23rd of May, that was a shocking news actually for the staff and also the residents. Remember, because we've been working for almost 2 months with the promise that we will be funded. Unfortunately, we didn't get any funding.
He worries that the centre could be forced to close, derailing the recovery of those patients in the early stages of treatment. The minimum treatment period for addiction is 3 months. Mangoba says staff here are staying on until the current treatment period has ended.
The reason we offer to volunteer until the end of month, June, is because social work is our passion. We love social work, we love our profession by heart. And remember, these residents that are here need to provide service to them, make them fit and prepare them to go back home in a good state. Because as much as it is happening, they are still human beings. They deserve another chance.
Recovery can be as complex as a game of chess. These residents say their sobriety depends on the program.
They say relapse is part of recovery, but we don't believe in it because relapse is when you want to stay addicted. We don't want to stay addicted, we want to change.
Because also by communicating with us, that's how we can also maintain the sobriety.
I'm depending on this place because when I came here, I prayed for God to show me a purpose in life. And it didn't take so long for me to come here. So which means the pastor care, the staff care, social workers, they learn you to deal with your issues, to identify your triggers, your weak points, your strong points, to be a stronger person, to make better choices in life, because it's not that we like drugs, but there's something that pushes you to drugs.
Paseka Maseko, once a Nyaupe user, was rehabilitated here.
I struggled with addiction for many years, so when I came here, I was 29 years of age. I was addicted to heroin for 15 years until I came to FRC seeking help.
7 years later, he is now the one who helps drug users on their long and difficult journey to sobriety.
I'm in detox. It means detox is the first stage of recovery. That's when new people come in, they withdraw, they struggle because it's the first few days. So I work with them. In a sense, that motivates me, that gives me purpose, because I'm able to see a person on the first day and I'm able to see them as they grow in their recovery. So yeah, it motivates me a lot.
Like all recovering addicts, he fears that he might relapse should the center close permanently.
So immediately, I heard this place is closing. I felt like I'm losing that purpose that I started to have for myself. Financial struggles as well, because whatever little that we get here, I'm able to save, and then I would do short courses, things that I know in future will benefit me in a positive way. So it means I just saw my whole future fading away. Yeah.
Finding alternative funding is difficult, as potential donors tend to be unsympathetic towards addicts.
95% of our funding is coming from Gauteng Department of Social Development. One of the reasons why, if you are knocking on doors of companies, name it, and you are saying this is us, Freedom Recovery Centre, Drug and Alcohol Rehabilitation Centre, they are very open with you and say, if I have to choose between an orphanage or a disabled home and a drug rehab, I'm sorry, but drug rehabs are not on our list, because the belief and the stigma still is out there that you have done it to yourself.
The impact of this hits deeper than the organization's financial reserves.
And they even said to us, you know, Pastor, even if we have to eat pap 3 times a day, I'm just not ready to go out. I just want to complete my program, and I can't go back to drug addiction, and it destroyed me so long. And I can't do that to my family anymore. And even when they found out that our staff hasn't been paid for 2 months, still our residents gets nothing, but when they get something they want to share with our staff, because that's the kind of relationship that we build.
By the time of broadcast, the department hadn't responded to our requests for comment, and the Freedom Recovery Centre will have to close its doors.
Welcome back to Healthbeat, where we're unpacking what it means when government funding for the care of our most vulnerable is reduced or disappears. Ongoing budget cuts for social care organisations create insecurity in the social welfare sector, and these are organisations who largely do the work of government. Section 27 explains how services to vulnerable people have been cut. The Gauteng social development budget has been cut from 2.13 billion in 22-23 to 1.9 billion this year.
I can take you back from 2022-2023 financial year. When we look at 2023-2024 financial year, we see that there was some sort of budget cut. And for this year, there was a huge cut as compared to the previous years.
Organisations that have been approved for funding receive a contract from the Department of Social Development.
Once the department is satisfied that actually you are doing the work that is in line with the Department of Social Development, they issue each organization that has complied with a document called a service level agreement, which is a contract stipulating the terms and conditions on how you're going to be working with the department. So it is a legal binding document.
But even this doesn't ensure payment. If the government doesn't hold up their end of the contract, NPOs can act.
They can first follow the internal processes, and if those internal processes are not helpful to them, they have a right to approaching the High Court for appropriate relief to enforce the service level agreement that is in place.
A structural interdict, then we should utilise that time and see whether we can move this forward constructively.
If not, the welfare burden will fall on families.
So some, they have already approached Department of Social Development in Gauteng to say that if the department fails to fund these organizations, their families, they will have no other option but to take care of their loved ones. They are not equipped to take care of them, and they have demanded the department to continue funding those organizations.
Les Sanabria is from the Gauteng Social Services Welfare Development Forum, and they represent up to 500 organizations. Les, what are you seeing on the ground?
I'm seeing total chaos and destruction. The whole foundation of social welfare services has to be rebuilt. And that's because of the fact that the MEC for Social Development, together with the Premier, decided to change the whole structure of the funding to NGOs.
Now, you represent up to 500 organizations, and you've also done a recent poll among them. Tell us more about that.
In June, I found that the majority of service level agreements had not been paid. The majority of service level agreements had not even been looked at by the Department of Social Development, and it seems like they are faced with further cuts in staff and further closures.
Now, this is not a new crisis. We've heard about it for some time. How long has it existed for?
It has been a crisis because every year the department has been late. In fact, there is a saying that there is a dry season from January through to May. And that's what regional officers of the department says to the NGOs. Make sure that you prepare yourselves for the dry season and take the subsidy that you get in December, because the dry season is for 5 months. But getting back to the department, there have been court timelines. They were given a timeline in June to have all payments done. They were given a timeline to make sure that there is a list given to the NGOs and to the court of who received and who did not receive, and give reasons why. We have not received such a list as yet.
Les Sanabria, thanks very much for your time today.
Thank you very much, Mia.
After the break, we look at the harsh reality of budget cuts.
The toll it has taken on staff is incredible. The hardship it's caused to people who need services is also been indescribable, and the department has really not taken any responsibility.
Welcome back to Health Beat. We'll be finding out how care organisations survive in a country with an ever-increasing welfare burden and slashed subsidies. During Life Esidimeni, over 140 psychiatric patients died because the organisations meant to care for them were ill-equipped to do so. Now, many NGOs that care for children, the elderly and disabled are struggling to survive. Lisa Vetten is from the Gauteng Care Crisis Committee, representing more than 80 social welfare organisations. She's even taken the government to court on behalf of them. Lisa, are we really facing the prospect of another Life Esidimeni crisis? Are things really that bad?
They really could be. I mean, one of the things we have to take into account is that government offers in Gauteng offers exactly 2 residential facilities for people with disabilities that accommodate 167. NPOs run 32 that accommodate 1,600 people. Where will they go if their funding doesn't come through? It's also been people in drug rehab centres, inpatient centres, child and youth care centres, domestic violence shelters, any kind of residential facility which is really someone's home, where you know, their rights to food may be compromised, obviously affecting their nutrition, their rights to care. In some facilities you do also have nursing care provided as well, your access to social workers and other kinds of support. All that was placed under threat by the department, who also have taken no responsibility in any way for recognising their part in this. Their attitude has been, when one has said to them, the organisation is going to close. Oh well, they must close in a responsible manner and let us know and we'll make a plan. That means you failed to think about the consequences of your actions at the time as to what the effects of your very poor decision making were going to be.
So at the end of June, where are we now?
The department has really dragged its feet in attempting to meet the court order. It certainly helped. It did spur them on, but money is trickling in very, very slowly. They did put in place these interim SLAs. They're interim contracts which at least buy time and give organisations funding until the end of August. However, the way those contracts are written, there's a good likelihood that we may face a similar scenario again in September. So we have to use this time now to make sure it doesn't happen again and to use the court order to prevent this from repeating itself.
Why is it always Gauteng that we hear about? Is it because of a large population or is it governance issues?
It's governance issues. Gauteng used to be one of the most efficient departments of social development in the country. This changed in 2022 when the political leadership changed. The effects of changes became obvious in the 2023-2024 budget. The Premier and the MEC of the time reprioritised expenditure and then took a significant chunk of money away from NPOs. And the NPO budget is an easy one to attack because it can be decided on a year-to-year basis. You can introduce all kinds of specious and spurious criteria as to why you can't give the money. So it means the money comes in, but you as government can withhold it and use it for other things and reprioritise it and channel it for other things. So in 2023-24, they first had a go at reprioritising. Protests succeeded in stopping that. But they did it again this year on even more dubious grounds, where a claim was fabricated to the effect that the Auditor General had made a recommendation and a finding that the entire process of funding NPOs had to be altered. The Auditor General has publicly stated that they made no such finding and no such recommendation, which raises all kinds of interesting governance questions about what were you doing? What were you hoping to gain from trying to alter the process in this way? And it is that which has created this really terrible situation where organisations worked for close to 3 months without funding. The toll it has taken on staff is incredible. The hardship it's caused to people who need services is also been indescribable, and the department has really not taken any responsibility.
Now you have taken the government to court on behalf of the Gauteng Care Crisis Committee. Is it really the way to go? Because the idea is to get them to pay up. Does it happen?
It's happened very slowly. I mean, one was driven to court because the department was not communicating. What they were saying was often dishonest. You know, initially they even denied there was a budget cut and tried to say that any claims we were making about a budget cut were false and that they were politically orchestrated claims. So, you know, when you're dealing with dishonest individuals, it's hard to make headway, especially when they don't communicate with you directly, but only issue public relations media, which is creating a particular kind of narrative. So, you know, many attempts to write to them just did not get anywhere. So first we organised a protest and then went to court in order to get an order to make them do what they are required to do in terms of the Constitution.
But we hear so often that there's a court order ordering the government to pay and then they don't pay.
So a court order is the best you can do to try and compel them to do what they need to do. You can use it to go back, and if you can still hopefully use the element of shame. And that did seem to work a little bit with the department in that they didn't want to be seen to not be complying, but it didn't mean that they in any way hurried to pay organisations.
You've mentioned that we could face another crisis in September and possibly next year. What can we do to prevent it?
I think the concern in September, and it's why we need to start working now, are these clauses in these interim contracts. They open up lots of questions. We also have to see that the Premier made this promise that he was going to increase the budget. Well, will the coalition government uphold that? That's something we're also going to have to watch. Because in September there is a suggestion that they could cut budgets yet again, that they could also stop funding to organisations, that they could also introduce new kinds of funding mechanisms. So that has all got to be clarified now. We've got to make it very clear that the department has to act within national policy. There is a national sector funding policy developed by the National Department of Social Development that does not allow the department in Gauteng to invent its own processes and procedures.
Lisa Witten, thanks for your time and insights.
Thank you, Mia.
That's our June show. Catch us on Bhekisisa's YouTube channel.